Vocal nodules can be defined as a swollen part or parts of the vocal cords. They can appear because of vocal abuse and/or overuse and become callus-like. Nodules can affect a person's tone quality of their voice and can cause pain to their vocal cords as well. In the summer of 2014, I was diagnosed with vocal nodules. Since I was about 10 years old, I've sung in choirs and participated in musical theater, public speaking, and news journalism classes each year. My case of vocal nodules developed because of vocal overuse. There is also some vocal abuse affecting my vocal cords because I wasn't breathing as correctly as I should have been when singing. Vocal nodules can develop because of many different factors for many different people. Whether you smoke, have allergies, sing, coach, drink, cheerlead, have caffeine or alcohol, or even talk too loudly too often, you may be at risk for having vocal nodules. There are many signs and symptoms of vocal nodules, and each person has a different sensitivity for their vocal cords. In this speech, I will talk about how vocal nodules are caused, the symptoms, and how to get rid or prevent them from appearing. I will start by looking at the symptoms of vocal nodules and what causes them to arise. There are several symptoms and causes of vocal nodules. Each symptom and cause varies for each individual. There are a few signs one may notice in their speaking or actually in their vocal cords that indicate swelling. Hoarseness is a huge indicator. If you have a scratchy or hoarse-sounding voice, more often than not, you might want to get your vocal cords looked at. That hoarseness applies to speaking and/or singing voices. It may not apply to both. One thing I noticed in my life as a singer is that I had a decreased range. That is another symptom of vocal nodules. It will be harder to sing either higher or lower pitches on a music scale, or both. While on the subject of singing, it may also be difficult to sustain a pitch for longer than a few seconds. Nodules make it difficult to sing softly, and the tone and vibrancy of the notes one sings is skewed. A lot of times, one of the first things people with vocal nodules notice is that they have an increased neck or throat pains, discomfort and tightness in the throat, and simply vocal fatigue. Now that we have discussed the symptoms, let's take a look at what factors actually cause vocal nodules to develop. The causes of vocal nodules vary for each person. Everyone has their own vocal sensitivity, and everyone participates in different activities, yet most people are at risk for vocal nodules developing if not careful. When a person yells or even speaks too loudly too often, the vocal cords slam together, creating tension on each cord. If there is excessive yelling, the vocal cords begin to swell up and form little blisters that can turn easily into nodules. Coughing and clearing your voice too often or too hard can also cause the slamming and eventual swelling of the vocal cords. If you are a singer, overuse of the vocal cords can become a problem. Mine developed because I have been singing every single year for the past 10 years, and sometimes it can take a large toll on those with weaker vocal cords. However, vocal abuse and misuse can affect the changes of someone getting vocal nodules a lot more. As singers, it's important to breathe above the diaphragm. You need a lot of breath support to sing correctly and avoid getting vocal nodules. A person with allergies or a person who smokes is also at a high risk for getting vocal nodules because a person is not healthy when they have allergies or are smoking, and it causes you to cough and sometimes have lots of drainage, which builds up on your vocal cords and also rubs them together harshly. One more cause is drinking caffeinated beverages or drinking alcohol. It dries up the throat and vocal cords immensely. There are a variety of different causes of vocal nodules. Many people have encountered some of these signs or behaviors in their lives. Knowing these symptoms and causes leads us to take preventative measures and find a solution. Let's look at what treatment and prevention precautions can be taken. There are a few options for treating vocal nodules, but first you have to be diagnosed. To see if you have vocal nodules, you have to see an ear, nose, throat doctor, otherwise known as an ENT. An ENT will take a scope called a laryngoscopy and ease it down in the throat so that they will be able to get a visual on the vocal cords. While it's down there, they may ask their patient to say some words or sing some pitches that might be difficult to do with vocal nodules. When I had to get this process done, they made me say Coca-Cola because the C's are hard and it slams your vocal cords together, and sing some pitches that were higher or really low just to see what my range has turned into after having the nodules. This helps them see the vocal cords at their weakest point and assess the situation. The most common and effective treatments for a person with vocal nodules are voice therapy and voice rest. Sometimes the best solution is to stop singing or stop talking for a certain amount of time, diagnosed by your ENT or speech therapist. The vocal cords work very hard to support your voice, but especially when they have nodules on them. In voice therapy, a therapist will teach their patient how to speak without putting too much pressure on consonants and blending the vowels together. These methods will begin to stabilize the vocal cords and teach one better, easier ways to use their voice. The nodules can then go away in effectiveness and sometimes also in anatomy. Another solution is surgery. Non-microsurgery treats the nodules or other irregularities on the vocal cords. The method is often used on more severe cases of vocal nodules. This method will remove the nodules. However, there are risks with this operation. It could cause you to lose your speaking and or singing voice permanently. Just look at professional actor and singer Julie Andrews. She performed in many movies in singing roles. For example, she performed in the Disney classic as iconic character Mary Poppins with an iconic voice. Later in her life, in 1997, she was diagnosed with vocal nodules. She couldn't sing after having them surgically removed, thus eliminating that part of her life from her. Thus, we see that there are lots of different treatments for vocal nodules, and depending on someone's situation, the treatment can differ. There are a variety of ways vocal nodules can develop and a variety of ways they can be treated. The swelling of the vocal cords can be a result of a lot of different behaviors and can be treated with a lot of different methods depending on the patient's unique situation. We should all take effort in practicing healthy behavioral habits to avoid having to deal with vocal nodules in the future.